Thanks all of you for coming out today. Thanks to Duluth. Thanks to the Miller-Dwan Foundation. Thanks to the city of Duluth. We have a good friend who's in town. She works in development at a place you might have heard of down south in Minnesota called the Mayo Clinic. She said something last night which struck me in a different way this morning when she said, "There's something different about Duluth." And I thought about that. Rochester did not build the Mayo Clinic. Duluth is building Amberwing. And there's some amazing people that are here today, people throughout the city, donors, the Miller-Dwan Foundation, Mary Dwan, the Dwan family, the Miller family initially, decades-long history of looking around, seeing what is the biggest community public health need that this town needs right now, and then seeing about the process and seeing to the process of getting that done. That's the tradition of the Miller and Dwan families. That's the history of the Miller-Dwan Foundation. And the history of Duluth, again, there's just something different about Duluth. To see time and time again the people around the country that are amazed that a town can rally to pull together a project like this, a dream like this, and see it come to construction, come to reality. And as Rick, who you just heard from, has said many times, Amberwing doesn't start a year from now when this facility opens. Amberwing starts now, and that's an exciting thing. So again, amazing people here. Just a small fraction of the people that are putting themselves into this project. And to think also that this project, though it will have an important place in the mental health community for kids, teenagers, families, young adults, it's not the only place that's going to be a part of the mental health family too. Part of the challenge is going to be, how do we make this place work with the rest of the community, with our schools, with the many talented professionals, mental health professionals, school professionals, other professionals working with families, young people in this community. Amberwing, as many of you know that are familiar with terms like partial hospitalization and intensive outpatient and chemical dependency treatment, is especially built, you might say, to handle a very acute phase, a very short-term crisis phase, if you prefer to use that term. Intervening at the right place, at the right time, trying to provide a change of direction. Crisis is a time of opportunity. Amberwing aims to fulfill that promise. The other providers in this town, the outpatient providers, we have plenty of people that we know we need to integrate this facility with. And part of the goal when people finish their time here will be to have a plan that seamlessly gets them back to their lives. Nobody chooses to go into crisis. We aim to help people in that time. Miller-Dwan Foundation, of course, cannot act alone. We needed the community. And since Miller-Dwan Foundation does not operate hospitals, clinics, partial hospitalization programs, of course they needed a partner. And Essentia has been that partner to help deliver the care, to help design the care. I'm going to introduce the President and Chief Medical Officer of Essentia East Region, Tom Patno, who has been one of the leaders from this in the beginning. As soon as the Miller-Dwan Foundation came out with this big, audacious goal of building this facility, Dr. Patno and others in Essentia have championed the progress of this project. And so now I want to introduce Dr. Tom Patno.